Hi, it's Jessica DeMassa with WTF Health. I'm here in the HISA studio at HIC 2019, and joining me right now I have Maureen Perrin. She is a public health epidemiologist who's going to talk to us about pop health. But first we've got to ask her, Maureen, what's a public health epidemiologist?
So it's actually a pretty common question that needs to get asked. People are like, what is epidemiology? And there's a couple different ways of answering it. People think it's epidermis. It's not.
No?
It's not a skin
No,
thing.
you're not a
no,
skin
it's
doctor?
not a skin thing. Think about epidemic as the root word. And so what you're basically doing is, in epidemiology, it's the science of public health. And so what we're interested in doing is looking at the distribution and determinants of health in a population.
Okay. Now,
That's like my textbook answer that I memorized in school many, many years ago, but it still applies.
no, that's a good answer. That's a great answer.
Yeah.
All right, so let's talk about population health and how you as an epidemiologist are defining this.
For sure. So I think population health is a really, really huge, massive field. And so I come at it from a certain perspective, so it's probably easiest if I kind of tell you what my background is and how it kind of feeds into the whole population health world. So the biggest thing about population health is that we look at groups of people. And we want to be able to do kind of upstream interventions and preventions to keep people healthy.
Okay.
We do that in a couple different ways. And for various different health kind of conditions and just keeping people healthy. So we want to be able to think about infectious disease, so prevention, promotion, healthier behaviors. And instead of saying, I'm going to sit across from you, it would be great if you, for example, thought about your smoking behaviors. What we want to do is we want to change things to be able to say it would be even better if we could make it harder for you to smoke, or if we could put other things in place to make that behavior less something that you would want to be able to do and give you a healthier behavior.
Okay, so like making like a smoking ban in like a public place.
Yeah,
Okay,
exactly.
got it. Okay.
Exactly.
All right.
Yeah.
So you're shifting behaviors in that way, and then then how do you account for individuality and differences? Is there a way that gets taken into consideration in your work, or are you really looking at it's such a vast number, and the problems that you're trying to solve are just so big, like stop smoking, that there's really no need to account for any individual extras?
Yeah, great. It always comes down to individual behavior, so thank you. And now I get to talk about one of my favorite things, which is sexual health, right? Here we go. Because it's a really good example of what you need to do in terms of an intervention at an individual level, but also looking at the community, for example.
Okay.
So one of the things, and this is why defining population health can be such a challenge, is that you're going to do an individual intervention for somebody who's been diagnosed with an STI. Let's talk about chlamydia. Chlamydia is super common. It's one of the most commonly diagnosed bacterial STIs. So if somebody gets diagnosed with chlamydia, we want them to be able to come to a healthcare provider, obviously to get that diagnosis, to get screened, and then we want to make sure that they're treated, but also their partners are treated. And then we're going to talk about safer sexual health practices as well, right? So that's looking at that individual behavior, but it has consequences in terms of transmission to others.
Okay.
Yeah, is that like an example?
Absolutely, yeah. And I mean, I'm thinking to myself of all of the anti-vax stuff that's happening in the U.S. right now.
Big deal.
Yeah, weigh in on that for me, Maureen. What do you think about something like that? I mean, especially when there's so much data that shows that a lot of these vaccines were actually able to stop epidemics, and now all of a sudden, measles is coming back. So, I mean, talk to me about that a little bit.
Yeah, it's a really tough one, and I think it kind of lends that question of data doesn't always make a difference in terms of how we make decisions, right? We use our values, our attitudes, our beliefs at the end of the day, and sometimes the data doesn't make a difference. And so how do you have a debate when it's not a debate? It's just the evidence. Vaccines save lives.
Right.
So it makes it really challenging. And one of the articles I've read lately has said one of the biggest problems is that it's actually related to people's faith in the system, which is something we've talked about here. And that makes it a real challenge.
Faith in the healthcare system.
Faith in the healthcare system.
Right.
Faith in the doctors and the pharma and all the other kind of machines around the vaccines. Yeah.
So, I mean, on that same issue of faith, I love what you just said here. And so how do you overcome that when it is a matter of like something personal, like not believing in the system, like a personal belief? I mean, when you're talking about, some of these big, STIs, or you're talking about quitting smoking, or you're talking about, some of these other like massive healthcare problems, vaccine, to vaccinate or not to vaccinate. I mean, there's a lot of different things that, you would be able to, I don't know, you might have an ethical preference or a religious preference or spiritual preference about. So, I mean, how do you overcome that when you're looking at shifting behavior change to improve the health of the overall population?
So it's a really interesting one from a population health perspective, because often population health is going to limit the choice of an individual. Not something that they want to do.
No, right.
And you've seen people come in and say, you know what, you can't send your kid to school unless you're immunized, because there's enough of a risk there, you're going to harm others, that we're going to restrict your rights and your choice. And so that's when it becomes a legislative issue or an intervention where your right to choose has a negative impact on others, therefore, you don't get to.
What do we do with technology moving into this healthcare space, and how that's starting to just shape the way we're looking at populations and data? And it's like data is becoming its own population, really. It's like in the abstract, it's like we're not even people anymore, it's just a population of numbers. So, I mean, how are you seeing technology changing this space? Is it good or is it bad?
I think in general it's really good. It gives us so many opportunities. At the end of the day, it's all about our stories, though, right? We can sit here and we can quote numbers and we can talk about like the number of people who have been impacted by measles, but it's that one story. It's that one turtle with the straw in its nose that results in a ban of straws, right?
Yeah.
So we're motivated because we are storytellers. I think that the data that we get out of population health systems and from technology allows us to challenge our biases and our beliefs about what's actually real. And I think that's one of the powers of it. So I would say, just from the point of view of going back to vaccines, from a public health point of view, we've now been able to create registries or being able to track people's immunizations. We've got clinical decision support, which says, if you have slightly different medical conditions, there's an algorithm that can actually help make sure you're getting the vaccines that will keep you safe.
Yeah.
And then if there's an outbreak of measles, public health can go to that registry and say, do I have herd immunity? Like, are my people protected? Who needs to go and have another immunization to make sure that they're not getting measles? So it's a kind of a simple example, but
I was going to ask you, so as I'd like you to give some advice then from an epidemiologist's perspective.
Okay.
Yeah, no, so for the technologists who are out there watching this, and as they're starting to develop solutions, and everybody is really excited about all of the ability to, change behavior in populations of people, to improve the health of entire cohorts of people. And you've worked with data, for a long time, and as we start to get more and more data, and the data is richer and richer, and we start to apply AI to it and start to look at, kind of the way the data is synthesized, and we're looking at in aggregate, this information. Is there advice that you would give from somebody who's spent time looking at data in the before of technology to what could potentially happen in the after? And I'm talking, I guess, about some of those data biases that are being, programmed in, or, things like that. We're losing some of the human element of even just processing the data and figuring out what it is, right? So, from your perspective as an epidemiologist, would you give some advice to the technologists out there for us?
Yeah, I think about the problems you're solving. Right? And then what data you can use to actually support or refute your position. Because I think at the end of the day, the data is a tool. It's a hammer. It's however you actually want to employ it and use it. And I think the availability of data and the way that we can use it to challenge our biases, the way that we want to be able to create broader pictures. Even when you look at population health, for example, you want to make sure that people are included. Are women well represented? Are people with chronic conditions well represented? So you have to be able to think about broadly what your problem space is, and making sure that at the end of the day you've got health equity. We all need to make sure that the people are the healthiest that they can be, and I think that data and understanding the underlying conditions really has a role to play in that.
How do you make sure that you are collecting data in a way that is respectful of equity, so that all those people are represented?
Yeah, I think it does come back to being able to ask the questions and being able to understand. I think it's a big mind shift, frankly. I think that with some of the movements that are happening now in our kind of current culture, people are more willing to ask the questions. People are coming out with their voices to say, have you included our group? Yeah, have you included our group? And by the way, that's not good enough, right? We need to be looking more broadly and making sure that we have a representative sample and that we can address it. Even the simplest example is gender disaggregation.
Yeah.
Right? Where you're going, okay, obesity is 70%, but it disproportionately affects women. Those women should have different intervention programs than the men to address those underlying health issues.
Absolutely.
Right?
Yeah. So what do you, last thoughts from you, and I'm curious to know, where do you see the future of pop health, moving? And are you, what are the biggest, in the States right now, I'm not sure if anybody's familiar with it, there's everything is an epidemic, everything is a crisis. There's seriously, no, I have a list. I have a list on my phone.
Really?
Yeah, of 9 different, you should. Yeah. 9 different epidemics, 7 different crises, And then just for fun, I'm keeping track also of the number of places the healthcare system is broken. Currently, I'm at 5 clocked, where I've actually read articles about this, and I'm like, okay, like this is another one, I'm adding it to the list. So, I mean, as far as like public health and population health is concerned, what do you think is the biggest crisis or epidemic facing us as we move forward? I mean, on a global level. I know you're from Canada, but like, I mean, what do you see as something that we really need to get our act together and take on?
Yeah. The issue that I would highlight for the group would be antimicrobial resistance.
Okay. Meaning?
Absolutely. So it's basically being able to say that if you're going to go in for surgery, we want to be able to give you an antibiotic to make sure that you don't have an infection after that procedure. And antibiotics are becoming less effective.
Okay.
Right? They're developing resistance. So if you are sick, we're going to give you something, but if you don't take it properly, that bug is going to mutate. And that antibiotic we've developed, and there aren't that many of them in the world, is not going to help you. So that infectious disease burden is going to come back if we're not careful, and I think that's one of the biggest issues that we're seeing right now in public health.
Oh my God, another one to add to my list.
Okay, there we go.
Great, thanks a lot,
There we
Maureen.
go.
All right, what has you most excited? What do you think is one of these epidemics we're facing now? Opioid, obesity. I mean, there's so many of them, right, that you think is going to be actually fixed by the way that we're handling things. Is there anyone out there that you think that we're going to make some good headway on?
I'd like to be able to kind of say yes based on that.
Well, I'd like us to end on a high note here.
End on a high note. I think that we are able to see being able to bring communities together and being able to bring people together. And at the end of the day, it's that kind of that passion and that willingness to make changes that is going to help us. So opioids is a huge issue. And if we can get to the point where we're like, you know what, we're people, and it comes back to that health equity thing.
Yeah.
They have as much right to treatment as anybody else. They need stable housing, right? We need to be able to give them the care. It's not a criminal issue, it's a public health issue.
Absolutely.
I think that will really make a huge difference in the world.
All right, Maureen, thanks so much for letting us pick your brain. I'm Jessica DeMassa here with WTF Health at the HISA studio at HIC 2019. Thanks for joining us.